The broadcast is now starting. All attendees are in listen-only mode.
Good morning. Thank you for joining us on this last day of June in 2020. We have certainly had an unprecedented 4 months. My name is Mark Levine. I am the Deputy Director of your New York State Association of Counties. And on behalf of our President, Jack Marin, the Chair of Ontario County Board of Supervisors, and our Executive Director, Stephen Aquario, I'd like to welcome you to this morning's webinar. Nearly 4 months ago, the President declared a health emergency in the U.S. based on the pandemic that was increasing rates of COVID-19 infection in communities across the nation, but in particular in New York. This declaration triggered a federal government pledge to provide funding through the Federal Emergency Management Agency, or FEMA, for organizations and governments fighting this disease. This morning's webinar was put together to help counties understand some of the aspects of applying for federal reimbursement or assistance from FEMA for COVID-19. The webinar is designed to provide you with guidance on the eligibility standards for applicants under a FEMA disaster grant and what types of activities are reimbursable under the state's current emergency declaration. If you have any questions along the way, please type them into your participant panel area, and we will get to as many questions as possible at the end of the presentation. At this point, before we get started, I would like to pause to thank our webinar sponsor this morning, Civic Plus. Civic Plus offers local governments technology solutions for website design and hosting, parks and recreation management, agenda and meeting management, employee management, mass notifications, citizen request and work order management, and digital optimization. With more than 20 years of experience focused exclusively on local government, Civic Plus works with over 4,000 municipalities to help them achieve more with less. Reach out to Civic Plus with your needs, and they will ensure your technology needs are met. Thank you, Civic Plus. Now for our presentation this morning. Our first speaker is Andrew Martin. He is the Public Assistance Chief at the New York State Division of Homeland Security and Emergency Services. He specializes in supporting and advocating for New York communities, nonprofit organizations, and state agencies recovering from disasters in order to help them build a more resilient future. Andrew worked with or for FEMA for a dozen years before joining the Division of Homeland Security between 2007 and 2019, most recently for FEMA itself. Before he worked for FEMA, he worked with a FEMA contractor managing FEMA Region 2's Support Center team in New York City as part of the Risk Assessment, Mapping, and Planning Partners team. He worked with DEC, the New York City Department of Environmental Protection, and the New York City Mayor's Office of Long-Term Planning and Sustainability. We are pleased that Andrew is with us this morning, and I have the pleasure now to turn the mic over to Andrew. Thank you, Andrew.
Thank you. Good morning, everybody. So again, my name is Andrew. I'm the Public Assistance Section Chief with the State of New York Division of Homeland Security and Emergency Services. So just want to say that I recognize that these have been challenging times for everyone on the call today, and that you're all extremely busy, but I would like to take this opportunity to provide you with some information about applying and preparing for submitting projects for FEMA's Public Assistance Program. So, like we just mentioned, the President issued a major disaster declaration for New York State on March 20th of this year. The disaster number for that declaration is 4480. So you'll see in a lot of locations the letter, the alphanumeric call sign of DR 4480, and that is a specific reference to the FEMA disaster for COVID-19. Now, the incident period for this declaration actually goes all the way back to January 20th of this year. I think that's when the first case was confirmed in the country. or perhaps in the state of New York, I don't remember, but anything that occurred, eligible expenditures for activities conducted on or after January 20th in order to address or fight the COVID-19 pandemic are potentially eligible for reimbursement through the Public Assistance Program. Right now, there is not an end date for the incidence period. We do expect that FEMA will establish an end date for the incident period at some point in the future, and of course, we'll make sure that information is well shared and known as soon as we have that information. Now, this FEMA disaster only covers what we call Category B, or emergency protective measures, and I'll discuss what that means a little bit in a few slides. So public assistance is it's a reimbursement program. So FEMA provides financial assistance for eligible expenses that are a direct result of the declared event, COVID-19. Next slide, please. And before we dig into some of the details of this presentation, I just kind of want to do a summary of key takeaways. So just given the unprecedented size and scope of this disaster, counties should think about how they're organizing themselves for the public assistance program. You know, obviously, each county has its own set of needs and preferences in terms of how they organize, in terms of who would be the applicant for the county. But I just want to make sure that everyone on the phone is aware of different options and different approaches. For example, some counties might prefer to have the main county government as the primary or sole applicant for the county, and they would submit projects for the county agencies that are under their auspices, like the County Department of Health or the County Social Services. And some counties might prefer to have individual agencies manage and seek reimbursement for the projects on their own. This is up to each of you individually, but I just wanted to ask you to think about this, how you organize and structure yourselves based on your county's, how you organize and what your financial structure looks like, as well as the government's desired level of oversight over the subordinate agencies. And as you think about it, every county that's in the public assistance program, we have an assigned DHSES staffer that's already been assigned to work with you on the development of your projects. Please feel free to reach out to them, ask questions about what makes sense and how we might be able to help you. Now, in terms of eligibility, I'll discuss what an eligible applicant is, what is eligible work, and what are eligible costs for reimbursement in this disaster. I'll talk a little bit about documentation. This is one of the most often overlooked and often most challenging aspects of disaster recovery in terms of FEMA reimbursement. This is an item of critical importance to making sure that you're successful with that reimbursement program, and maintaining complete and comprehensive records of invoices, labor, supplies, and equipment is really, really important. And finally, timelines and deadlines. For the FEMA PA program, most deadlines revolve around the public health emergency, which again, that is still open as well. There are a number of specific items, specifically the request for public assistance, identification of work costs and activities, and the completion of work, all have important associated dates that you'll need to know, and I'll share those with you in a later slide. Next slide, please. So a little bit more detail here. So individuals representing nearly every county across New York have attended one of our virtual applicants briefs. We hold these on a bi-weekly basis now. We've held 50 to date since late March, and we've had over 11,000 attendees. If you have not had a chance to attend one of our briefings, I just encourage you to do so. I know there's a lot of similarities to what I'm going to share with you today, but we go into a lot more detail on specifics in those applicants' briefs. And it's also available online at our website, along with a ton of additional policy guidance and training information, and the link is right there on the screen. But if you go to Google and just type in DHSES Recovery COVID-19, you'll be able to find it pretty quickly as well. And of course, you may reach out to us directly. We have a specific dedicated email address that's there on your screen, dishes.pa COVID-19@dishes.ny.gov. All right. So now we'll cover eligibility. Let's go to the next slide, please. So So this is what we call the pyramid of eligibility. All four tiers that you see here on the screen we have to achieve eligibility for each of those in order to obtain FEMA funding through public assistance. We're going to cover all of these, and we'll start with the bottom tier, which is what's an eligible applicant. Next tier, or next slide, please. There we go. So on this slide, you can see the types of eligible applicants and determine what group you fall into. Everybody here is a county government, I assume, for the most part. County governments are eligible applicants, but I wanted to make sure that you're aware of what some of the other eligible applicants might be, because there are still a number of communities, there's a number of private nonprofits out there that have not submitted requests for public assistance yet. And, I'd ask for your help in reaching out to those communities and PNPs to make sure that they're aware that they are potentially eligible for public assistance, and hook them up with us so we can try to get them into the program. So yeah, like on the screen here, there are two different types of private nonprofits that are eligible applicants, but for this disaster, the differences are not really that important. Both types of those PNPs are eligible applicants for this disaster. Next slide, please. So eligible facilities. For many communities, there may not be a physical facility involved in this event. Typically in a natural disaster, we have buildings and assets and facilities that are damaged or destroyed by a natural disaster. In this case, we were dealing with a pandemic. It's largely invisible in terms of the damages it causes to structures, but it does obviously cause a lot of damage to humans. However, there is still a need for private nonprofits to demonstrate that they have a facility that's operating, that they own or lease in the state of New York. An example would be a hospital or a health clinic, and they have to demonstrate that they have a physical presence in the state of New York to be eligible. For counties and municipalities, that is not a requirement. Now, I wanted to mention one last thing on this, on that last slide. Thank you. I just wanted to mention that, many applicants, many counties and communities across the state may be receiving, or likely are receiving, federal aid from multiple federal agencies like the United States Department of Health and Human Services. And we just want to make sure that we're able to capture and document where that aid is coming from and where it's being utilized to avoid potential duplication of benefits under the FEMA Public Assistance Program. And I'll get into that a little bit more later in the presentation. Okay, so eligible work. In this event, we're looking only at one category of work. It's called emergency protective measures. Applicants, the counties, must clearly identify the work they're doing and how it is directly related to the COVID-19 event. Applicants need to have legal responsibility to perform that work. And there are some time limits to completing the work, and we'll discuss that time limit in the next slide. So for costs to be eligible for the FEMA Public Assistance Program, they must be incurred within the approved period of performance. For Category B projects, emergency protective measures, the approved period of performance for this disaster began on January 20th, and it ends 6 months after the declaration date, which will be September 20th of this year. Now, there are certain types of work, including non-congregate sheltering and food purchasing and distribution and medical care, that have very unique periods of performance that are tied to the public health emergency, and I'll touch on that in a moment as well. So again, this disaster was declared only for emergency protective measures. There are no other categories of work that are eligible for reimbursement. However, there is something called a Category Z project that's for management costs, and management costs are eligible to be reimbursed by FEMA for this disaster. Now, this is the first time that a major federal disaster declaration has been declared for a medical event or for a pandemic, and it's the first time that emergency protective measures have been eligible for reimbursement through the Public Assistance Program for a major disaster based on a pandemic. Now, due to this unprecedented event, we are working very closely with FEMA on a daily basis to provide as much specificity as we can on what cost and what activities are eligible for reimbursement. These discussions are continually upgoing. We're continually getting new information and new guidance from FEMA, and we're posting that on our website on a weekly basis. Next slide, please. So I wanted to, highlight a few specific types of work activities that counties across the state may be undertaking themselves that may be eligible for reimbursement through this disaster. This list is by no means all-inclusive, and there may be some leeway for some previously identified measures that were undefined. We're still working with FEMA on getting clarity and granularity on. So I'll just go through these really quickly here. So emergency operations centers, a couple of examples of things that are eligible are the backfill employees, temporary employees, and overtime for full-time employees and temporary employees. Public information sharing, so flyers and updates to your website, anything you're sharing with the general public about the COVID-19 and actions that you wish them to take, that is all covered. The printing, the distribution of flyers, the time that it takes to update your website, all potentially reimbursable. Coronavirus testing. Now, if that's carried out by the county or municipality, the costs are potentially reimbursable through public assistance. There's also a large statewide program going on, and there may be some costs associated with assisting the state. But again, I'll ask you to work directly with your disaster assistance representative on organizing those applications and those submittals. PPE, personal protective equipment, is eligible, generally speaking. Medical supplies, non-congregate sheltering, I mentioned that a few minutes ago. So many counties across New York State are carrying out non-congregate sheltering programs. In some cases, there's 4, 5, or 6 programs going on, housing different populations, whether that's folks that were priorly, before in a congregate setting like homeless or domestic violence victims that needed to be moved into a non-congregate setting in order to help protect them and the public health. There are a lot of elements of that are reimbursable through the program, and we've been working with several state agencies to reach out to the counties to find out what's going on with that and to get data and information. But long story short, much of that is potentially eligible for reimbursement, assuming that all of the FEMA requirements are followed. In addition, there's food purchase and delivery. Similarly, for certain populations, the purchase and distribution of food to vulnerable populations is eligible for reimbursement through public assistance. Now, again, if you have specific questions on any of these measures undertaken or an expense that you incurred or expect to incur, please raise that issue as you develop your FEMA public assistance projects, with your disaster assistance representative, and we'll make sure that you're getting good guidance on how to organize and submit your projects. Next, thank you. So FEMA has released updated policy guidance regarding the public assistance program eligibility of several important COVID-19 response and recovery efforts. These are long, detailed documents on medical care and alternate care sites and the non-congregate sheltering we just talked about and the food purchase and delivery. All of these are available on our website. There's a lot of detail, a lot more information on the requirements and the necessary documentation that needs to be developed in order to support projects for these. But it is helpful and it's useful. Next slide, please. So eligible costs. This is the final piece of the pyramid here. So the key here is that all costs must be documented and comply with appropriate guidelines. And they must also be reasonable and necessary to protect the public from the COVID-19 virus. Next slide, please. So circling back to documentation, I mentioned this at the beginning of the presentation. the criticality of good and comprehensive and complete documentation. It is, it can be a big challenge for applicants, and we've seen that in past disasters. Keeping a comprehensive and complete record of invoices, timesheets, equipment usage, is all paramount to a smooth and successful process in the FEMA Public Assistance Program. So when FEMA is evaluating the potential eligibility of a purchase for reimbursement, they do require documentation to confirm that the purchase or the use of something was tied to the performance of eligible work, that it was necessary and reasonable to accomplish the work correctly and efficiently, that it's consistent with internal policies at the county or the local level, with regulations and procedures of that individual applicant. And one takeaway here is that just a best practice is to prepare for FEMA's review of cost eligibility, is to track the procurement of any item that you might be submitting for reimbursement from the initial request to the final disposition. Every applicant that possesses a comprehensive and complete documentation record is going to maximize their reimbursement of costs submitted to FEMA. And it's just important, it's really important to understand the breadth of this potential request from FEMA. So talk a little bit more about that tracking and disposition. So at the end of the public health emergency, applicants must account for any unused materials funded by FEMA. If an applicant purchased supplies for its own use, FEMA is going to say how many of those, how much of that was actually utilized. They will accept a certification from you as the applicant regarding the amount of any unused supplies, but you must be prepared to provide source documentation if there is an audit, down the road. Now, if you as the county purchase supplies to be distributed to other agencies or entities within the county, you really need to be careful to track how much, what kind of materials they were, how much were provided to which agency, and provide that information to FEMA. FEMA is going to require the agency to track the usage of those supplies that are distributed, and they will accept the certification from the agency or the entity that it provides to the applicant regarding the amount of any unused supplies. But again, the applicant must be prepared to provide source documentation on all of this if you get audited down the road. Next slide, please. So donated resources is something we get asked about a lot. There have been a lot of donated resources for this disaster, whether that's volunteer labor or actual material goods. Those donated resources can be used to offset the local cost share of emergency work. For this disaster, the federal cost share is 75%, so that means FEMA will provide reimbursement up to 75% of your costs, and the non-federal share is 25%. So that would, is often up to the applicant to cover that 25%. However, donated resources can be used to offset that local cost share. If that is the case for an individual project that you have at the county level, FEMA will create a separate project for you to capture those donated resources. So it's really critical to document all the donated resources that have been provided to your counties and detail who, what, when, where, and why. All very important for that. Okay, thank you. I'll just do a quick few slides on the public assistance process. So FEMA has made some modifications to how they deliver public assistance specifically for this disaster. They have done this to try to expedite the process to get funding out to applicants as quickly as possible. So right now we're still in the early stages. We're in the first step or two here in terms of providing applicants briefings, getting communities and applicants accounts in the FEMA grants portal, submitting their request for public assistance, and now we're starting to see some applicants submitting their projects for review and reimbursement through the program. Next slide, please. So FEMA has developed a new, like I mentioned before, they have a new delivery program, but they also have a new project template, and they have what we call an expedited project option as well. Now, this expedited project option will allow applicants to submit draft scopes of work, draft cost estimates with minimal supporting documentation. Once that's submitted, FEMA will review it, and they'll develop a formal project out of it that'll be sent back to the state as the recipient and to the applicant for review and discussion, and a little bit of back and forth. So these expedited projects can be initially funded up to 50% of the original approved estimate, and that can be done relatively quickly. And after that happens, applicants can request that FEMA create amendments down the road to capture full actual costs once you're able to provide a more robust package of documentation and information. And along with this expedited project model, FEMA is also looking to expedite their environmental and historic preservation reviews, and they're looking at a very broad approach for that. And they're willing to, I don't want to call it a category exclusion, but they are looking at broad categories of things where they're pretty sure that there's not going to be any kind of environmental issues, and just pushing those through the system rather quickly. Historically, what we call EHP, environmental historic preservation, can be one of the slower steps in the process, and for this specific disaster, they've really sped that up, and that is certainly appreciated and helpful. So I'll touch on this, the RPA, very quickly. The overwhelming majorities of counties across the state do already have submitted and approved requests for public assistance, but for the few of you out there that have not, I would highly encourage you to submit your request for public assistance. There is currently no deadline to submit your RPA, other than to say it is, 30 days past whenever the public health emergency closes. That is still open, and therefore the deadline is still wide open at this time. Again, just want to reiterate, for the counties that have not submitted RPAs yet, please do so. Reach out to me, reach out to my team, and we'll help you get that in and approved quickly. So another deadline is the identification of costs and activities related to work that's being performed by applicants. Typically, it's 60 days after the declaration of a major disaster. For this disaster, applicants must identify and report damages, quote unquote, either 60 days from the end of the public health emergency or 60 days from the approval of their request for public assistance, whichever is later. That's a key phrase there, whichever is later. How that is done in this case, since there's no actual physical damages to record to facilities or roads or bridges, is through the submittal of a project in the FEMA grants portal system. Now, there's a couple exceptions to, I mentioned earlier about completion of work for non-congregate sheltering, food purchase and delivery, and emergency medical care. Just wanted to highlight that. Okay. All right, so another very important area to talk about today is procurement and contracts. So all contracts and purchases must comply with local, state, and federal procurement requirements. While some requirements may be suspended in the types of circumstances we're seeing in COVID-19, it's prudent to make sure that your contracting and purchasing folks are taking all reasonable steps to comply with whatever requirements apply and follow the appropriate guidelines. FEMA staff will be reviewing contracts. All projects are subject to audits by both state and federal Office of Inspector General. Detailed procurement guidance, including procurement in emergency and exigent circumstances, is available on our website as well as FEMA's website, and I encourage you to take a look at that. The contracts Contracts need to follow all the appropriate guidelines with the understanding that FEMA staff will be looking at these closely. But a couple of things I want you to be aware of that might jeopardize reimbursement. Cost plus percentage of cost contracts. That's where a contractor says that they'll do, X work for whatever it costs them plus a percentage of that cost. For example, if a contractor spent $100,000 on the work and the percentage agreed on is 15%, the contractor would receive $115,000. In this type of contract, there's no incentive for the contractor to work efficiently or swiftly. And the more time they take, the larger their profit is, and that would be considered an eligible contract by FEMA. So don't use that. There's also contracts that state that they are contingent upon the applicant receiving reimbursement from FEMA. That's ineligible. If the contract says something like the contractor will be paid by the applicant whatever FEMA pays, or will pay if or when FEMA pays, that's not going to be eligible either. So be very aware of that. Be careful when writing those contracts. Also, just want to make sure, avoid contracting with a debarred contractor. Make sure your contracting folks are checking the list. There's a website link right there at the bottom of the screen. Make sure you're not dealing with a debarred contractor, because that contract will be ineligible also. Management costs. So these are also called Category Z projects. So let's say a county comes in as an applicant, they submit a project. Along with that project, they'll be assigned what's called a Category Z project, so they'd have two projects. This is strictly to capture management costs. FEMA will reimburse an applicant's direct and indirect administrative costs incurred for submitting and processing its FEMA projects. That reimbursement is based on actual documented admin costs, and it's capped at 5% of your total Category B projects. Now, you must submit full documentation of management costs. And these projects, these administrative projects, this management costs are eligible for 100% reimbursement, of course, subject to that 5% cap. But that 100% reimbursement is really helpful. Okay, a couple key special considerations. Now remember that all funding that's provided from other federal entities needs to be tracked very closely. Needs to be taken into account and documented thoroughly. Now, an additional funding source that is common for in disaster scenarios is insurance. If certain activities or certain damages are covered by insurance, FEMA will require applicants to file a claim with their insurance companies on those damages with their insurance carrier, and it will deduct proceeds of that claim from the total eligible costs for reimbursement. It's not as big of a challenge here as we see in a natural disaster, but it is something to be aware of, and it's certainly going to be something that's necessary when you're talking about medical care, whether that's emergency medical care or alternate care facilities or even testing. FEMA is looking at medical insurance, and that's something that we certainly have never dealt with in the past, just given the nature of what we're dealing with now. It's a new element that we're dealing with. Now, like I said before, there's a particular likelihood from this disaster for other federal grant funding sources, such as funding through Department of Health and Human Services and the Center for Disease Control. It is critical that all applicants are able to report on all of those funding sources that were received and how those funds were applied across your communities, so that FEMA can ensure that there's no duplication of benefits under their public assistance program. So a couple things just to be aware of. Ask lots of questions. We like getting questions at dishes. That enables us to make sure that we're providing the best possible service to you, whether it's the initial development of projects or it's tracking, documenting labor down the road. don't hesitate to reach out. We've got a very robust team. We have a very dedicated and knowledgeable staff. Don't hesitate to reach out. Now, with the projects, do obtain FEMA pre-approval to change scope of work. If you are looking at a scope of work change somewhere down the road, please make sure you reach out to us, reach out to FEMA, so we can go through the formal process to get that done. Do follow procurement procedures. Like I mentioned before, that is a good way to get in trouble and to slow down the reimbursement process. Make sure those procurement procedures are followed closely. Follow the initial scope of work, and if you can't, if there's a change needed, reach out to us and let us know. Make sure to meet those public assistance program deadlines, and again, please keep complete, clear, and accurate records, from start to finish. Okay, just a couple, last slides here. Just wanted to note some of the key players in this disaster. We've got the Commissioner of Dishes, who's also the Governor's Authorized Representative, the State Coordinating Officer. We've got Mr. Tom Van Essen, who is the Federal Coordinating Officer for this disaster for 48480. Ms. Ann Bink is our Authorized Governor's Authorized Representative. Mr. Dan O'Hare is the Deputy State Coordinating Officer, and then there's myself. And Ms. Kelly Summerman, that's a name many of you are going to get familiar with down the road. She's what we call our Disaster Assistance Manager. So once your projects have been obligated, Kelly and her team will be working closely with you, on the administration of your projects after the initial obligation. And she's very good and she's very dedicated. So I think you're gonna find her very easy to work with as well. And then of course we've got our entire state and FEMA team. They're all happy to work with you. Don't hesitate to reach out. And of course our county emergency management partners. And this last slide, just some general contact info. There's our physical address, our website, and our dedicated email address. All right, so that concludes the formal presentation. Just want to say I appreciate your time today. I appreciate the work you're all doing. It has been a challenging 4 months, to say the least. But I got to say, I'm very proud of the state of New York. I think we've done an amazing job, and that hard work and that effort it's really showing now. So, congratulations to you and your communities. Things are looking up right now. I know across the country it's a little bit rougher out there. So I'll just keep on keeping on. Everybody's doing a great job, and thank you for the work you're doing in protecting the people of New York.
Thank you very much, Andrew. This, again, is Mark Levine, the Deputy Director of the New York State Association of Counties. Andrew, we appreciate your time this morning, and we appreciate the partnership between the Division of Homeland Security and Emergency Services and our counties as we work through these processes over the next weeks and months. So thank you, Andrew, and thanks to your team. I hope you can stick around for some Q&A after our next presentation. At this point, I would like to introduce Mary Gates, the Ontario County Director of Finance, who will present the county perspective, if you will, on the process of organizing and applying for FEMA reimbursement. Mary was appointed the Director of Finance for Ontario County in March 2016. Ontario County is located in the Finger Lakes region and has a population of about 110,000 residents with an annual municipal budget of about $250 million. Ontario County is also the home of our current president, NYSEC President Jack Marin, who is the chairman of the board in Ontario County. Mary has a master's degree in public administration with not-for-profit certification through the College of Brockport and a Bachelor of Science degree in accounting from SUNY Empire State. Mary is skilled in government finance and accounting, public policy and policy analysis, budgeting, nonprofit organization finance and compliance, grant management, and Strategic Planning. We are pleased and honored to have Mary this morning to provide the county perspective on FEMA reimbursement. Mary, are you with us?
I am here. Good morning, everybody. Thank you very much. So the first slide that I have is one of the questions was who in your county is tracking everything. So in Ontario County, the finance department is tracking. And we did that because we felt it was important to centralize the tracking and analysis of all of the financial aspects of COVID. The list here shows 8 departments. This is most certainly not an exhaustive list. We also have expenses in our correctional facility and some other areas. And as you can see, it would be hard to have all of them be able to coordinate everything. So we thought a centralized approach was a better approach. Next slide, please. So still the question probably remains, well, why the finance department? And the reason we chose finance is because there are so many funding sources available. We have funding through FEMA, obviously, Department of Social Services, Public Health, Office for the Aging, and several others. And we don't want to double dip, so to speak. We want to look at the entire picture. We want to maximize reimbursement revenue to the county, but we want to be careful about how we do that. So we actually have a grant coordinator in the finance department. So he is essentially our point person for this entire process. And we want to make sure that all the claims are tracked. We want to know what's out there, what's been paid, what hasn't been paid, who we need to follow up with. And quite honestly, that's what we do in finance. The other departments don't do that on a regular basis. They have their own mission that they need to focus on. And this will allow them, once we're done with this, and once we've gotten all of the information together and been able to claim, that will let them get on with what their mission is, and we will then pick up from there. And of course, when you get to any of the end of this project and any of these funding sources, there's going to be all kinds of audits and reviews involved, and finance really has obviously a lot of experience in that area, so it just made sense that this would kind of all culminate there. Next slide. So what we're tracking, similar to what Andrew had talked about, we're tracking equipment and contracts. Rental of equipment is included. Employees' time, the equipment that they use, so that we can maximize the revenue to us, the reimbursement for the use of that equipment, and then volunteers and donations, so that we can use that to offset our match for our local share. As Andrew also noted, discussions about eligibility and what costs are going to be eligible are still ongoing. So keep track of everything, because something that, you know, doesn't look like it's going to be covered right now, in another month after discussions might be. So we're kind of trying to keep track of everything that we can. Next slide. So in our financial system, the way we are keeping track of this is by setting up special cost centers right within the chart of accounts. So each department that has any contracts or is purchasing has a CV for COVID cost center attached to their main department. And we're tracking the revenues and expenditures there. So the reason why we're tracking both the expenditures and the revenue on a department by department basis is because it really is very easy at that point in time to then show the county costs associated with the pandemic, which obviously our board is going to be interested in, our administrative leadership is going to be interested in, and the public will be as well. So we're also using work orders. Now, typically we use work orders strictly to track time and equipment usage, But we're also adding the work orders in a way that we've designed within our finance system to our invoices as a double check. That way we can run reports on those work orders, and if something got coded to a main operating department instead of the cost center, we'll pick that up through that report and we won't miss things. And then there's essentially anything else we've got or we can get. So departments do their own thing on some of their tracking. The financial system is really not built to track things that we didn't buy or people that we didn't pay. So public health is using spreadsheets to track volunteers. Some departments have some internally developed programs that they're using to track costs. And things as simple as filing request sheets for PPE supplies that were requested and distributed, anything that we can to capture the history of that product. So if there was PPE bought, and then we need to know where all of that went and if it got used and who it got used by. So we're really trying to do this in the easiest way possible for our departments. Rather than forcing them into a special system, they have their own system set up. So we are sort of modifying our approach to be able to use their systems to not create additional burden on them. They've kind of got enough going on right now. So next slide. So our plans for claiming. We don't plan to submit one big project to FEMA. We do plan on doing multiple projects, probably by department or activity. And that's the way we've started structuring things within the department and tracking things. You wouldn't necessarily want the work buildings and grounds did related to cleaning or related to building sneeze shields or something like that on the same FEMA claim as PPE that we purchased or rented or rental equipment. So we're trying to segregate it in those ways just to keep it more manageable on our side. And then on the small claims, the claims that we know the work has already been done, we've done what we need to do and we can move on, we are filing that request for the project and then filing that claim and moving on. And that allows us to focus on the other larger, more complex portions of this funding. So the funding, it might also be easier to separate projects by funding. Projects that will have some sort of shared funding as opposed to 100% FEMA funded. That way you can really look at making sure that you're not double dipping. You can really ensure that you're looking at the whole big picture and making sure that you're claiming your expenditures under the grant that is the best grant for it, knowing that FEMA is the payer of last resort, so to speak. So we want to make sure that we are, regardless of how you set everything up, that we're clearly documenting everything, really know the limitations of all the funding sources that you have ahead of time. It's a lot easier to do that, to take a little more time up front to make sure that everything is organized in an easily manageable way for you. It's a lot easier to do that than to try to deal with the appeals later on or flat out denials. So that's what our approach has been. Thank you for your time.
Thank you, Mary. That's great information from Ontario County, and we appreciate you taking the time this morning to join us to give Ontario County's perspective on the process for FEMA reimbursement. In planning for this webinar, I talked to a number of different counties, including Oswego County, and these next couple of slides have been submitted by Phil Church, who is the Oswego County Administrator and a board member of the New York State Association of Counties. So we appreciate him participating in this panel. He could not join us in person because they have committee meetings this morning and in the mornings this week. So He's unable to join us, but I wanted to go through these slides on his behalf. And also I thank Steve Ludwick, who is the budget analyst, who is leading the charge in terms of organizing data for FEMA reimbursement for Oswego County. So here are the slides. Here's the experience from Oswego County. Unlike previous emergency events like ice storms, the county recognized early that COVID would cause most departments to incur some expenses. So tracking those expenses for FEMA reimbursement could become very cumbersome, especially with reduced staff during the past couple of months. So to track COVID-related expenses, in March, the legislature authorized creation of a COVID account line within the administrator's budget and capitalized it with $500,000 from unappropriated fund balance. Also at the time, the chairman, by executive order, emergency order, increased the administrator's budget transfer authority from $10,000 to $50,000. Next slide, thank you. County's budget analyst, this is Steve Ludwick, was assigned to coordinate with each department's financial staff to ensure all FEMA reimbursable COVID expenses were paid from the COVID account line. He is also the point person for state and FEMA interaction and responsible for submitting claims to FEMA once a FEMA rep is assigned to Oswego. To capture all expenses and pay from the COVID account, all county departments were directed to include the keyword COVID on all pandemic-related procurement documents, paper or electronic requisitions, credit cards, receipts, etc. And in the event that one of these might be missed on the front end, it is missing and it could be a COVID-related expense, their audit staff discovers it on the back end. All COVID-related overtime, additional hours, or compensation time is also noted on timesheets and in the payroll system, so that those expenses are also charged to the COVID account for reimbursement. Oswego uses the Munis financial software system, and a number of other counties do as well. By using a single account line, all COVID expenses can be printed out in a report for review by the legislature or the public and for FEMA claims. Examples of expenses for Oswego include PPE, personnel costs, technology for remote meeting, accommodations for quarantine, isolation, etc. The only COVID expenses in Oswego not charged to the COVID account are those covered by other grants or the CARES Act. Unbudgeted revenues such as these must be accepted by a budget modification resolution by the legislature. So they are automatically tracked separately within the department that receives them. This prevents claiming FEMA reimbursement for expenses that are already covered by another source. We are currently waiting, or Oswego is currently awaiting a FEMA rep to be assigned to them so that they can begin inputting their project claims. I thank Oswego County for submitting those slides. I thank Mary Gates for providing the Ontario County perspective. I thank Andrew Martin for providing the state perspective, as they are coordinating all the FEMA reimbursement applications through the state of New York from our counties and other local governments. At this time, I'd like to turn the moderator role over to Ryan Gregoire, the NYSAC Legislative Director, who will coordinate the question and answer portion of this webinar. Thank you all very much, and Ryan, take it away.
Thanks, Mark, and good morning, everyone. The first question that we have today is for our colleagues at the Department of Homeland Security and Emergency Services. So this question is for Andrew. If you submit a project and use an estimated cost, can the cost be amended since COVID-19 is still ongoing?
The short answer is yes. These are like it says, estimated cost. FEMA will take a look at those costs, and they will make a determination of whether or not they believe it's reasonable. Now, they have a number of different ways that they do that, but let's just, for argument's sake, say they come back and say, yes, generally we think your costs are reasonable, and they, obligate the project based on those costs. Let's say 2 months down the road, you find out that the costs are different, whether higher or lower. Yes, absolutely, you can make an amendment to the project, and it'll go through a similar review process, but that's certainly allowed and in fact encouraged. And once you have a better handle on, what your actual scope of work looks like, what your actual costs are looking like, absolutely, you should amend the project. And you can do that through a couple different ways. While FEMA is working to modify their grants portal system so that applicants can request to make amendments directly in the portal, we'd still recommend that you reach out to one of our DISH's staff that's assigned to you as the applicant to work through that process before engaging the grants portal. Our staff are incredibly knowledgeable, and they are specifically dedicated to serve you to make sure that you get the best possible outcome and result. So, that being said, I would highly encourage you to reach out to our team first to ensure that you're getting all the support that you possibly can.
Great. Thank you, Andrew, for that response. Really appreciate it. Just as a reminder for everyone who's tuning into this morning's webinar, you can submit questions by going to the questions tab on your dashboard panel, which should be on the right-hand side of your screen. If you click on questions, you can type in your question, and I will facilitate that with our panelists. The next question is for Mary Gates in Ontario County. And the question, Mary, is, I may have missed this earlier. I just heard that Oswego County uses Munis. Is this the process that Ontario County is using to track COVID-19 claims as well?
So that's an excellent question. Ontario County also uses Munis. The difference that Ontario County is, the different approach that we are using though is rather than having a special, just single line of expenditure, COVID line by department, we are setting up the cost centers there. So that provides for a sub-accounting, if you will, just from that cost center perspective. So we can still break out if the expenses are equipment or contracts or rentals. So we'll still know exactly what the expenses are, what category the expenses are, but then also we can apply revenue directly to that cost center to show the county costs for each individual department as well, and their process through the COVID response.
Great, thank you, Mary. This next question is for DISH's again. And the question is, we fully paid non-essential staff to stay home during the pandemic. Is this a cost that can be reimbursed through FEMA?
So I assume, got it, understood. Unfortunately, no. That, well, again, like I mentioned before, all policy guidance directives are still very much under development at FEMA. That is not something that FEMA is going to cover through public assistance program. Emergency protective measures, while their intent is to address or attack a specific disaster or specific pandemic in this case, that kind of preventative measure is not something that's going to be covered by public assistance, unfortunately. That's just the long and the short of it.
Okay, thank you, Andrew. And this last question is for FEMA again. And this question is, I know during the presentation, it was discussed that there was not a specific end date for a cutoff date for when you can apply for the disaster assistance program. However, can DISH's explain when they might anticipate such a date to occur?
So to apply, so that would be the request for public assistance and that is tied to the public health emergency. As of right now, we don't have a good idea of when that might end. Now, while things are looking really rather good in the state of New York right now, given the hard work that we've all put in the last few months, nationally, we're facing some challenges, particularly in the southern and western parts of the country. I mean, just yesterday we had a discussion with FEMA about this, and it's possible that they might end the public health emergency, you know, on a state-by-state basis. But the long story short is I don't know. FEMA doesn't know when that might end. It could be this summer. You know, if we see another spike in cases, it could be much longer. So again, I'll just go back to my earlier point, and that's just to encourage communities and counties to submit their request for public assistance as soon as possible to make sure we don't have to deal with that deadline issue. And I do want to loop back to the prior question regarding, you know, requiring non-essential employees to. I just want to mention that there are a number of other federal funding sources that might, you know, help address that issue, whether that's, you know, directly to employees through, you know, unemployment or other, you know, other avenues through other federal agencies that exist out there. So I just encourage counties and communities to help their residents by identifying those potential avenues for funding. It's not a great answer, but there are other avenues out there to assist besides FEMA.
Great, thank you, Andrew. And if you still have a few moments, we actually just had another couple questions come through, and I want to make sure we get to these. They're really good questions. Great. The next question is, will the state be using the CARES funding as a match to cover the non-federal FEMA requirement? I believe this is in regard to the 25% local match specifically.
No, understood, and that is a great question, very prescient question. So yes, the president, well, okay, let me back up. The president said maybe a month, 6 weeks ago that CRF funding could be utilized for non-federal share, and we just a couple of days ago got some formal acknowledgement of that. However, we don't have any formal guidance from FEMA or the United States Treasury on how that can be done. So the potential is there, yes, and the president has said that it can be done. Treasury has said that it can be done. We don't have a definitive path forward on how that's going to be done just yet. So I just ask that everybody stand by, and you know, once we have some more formal information and guidance and direction on this, we will certainly get it out there.
Okay, great. The next question is overtime covered in the sheriff department for correction officers and deputy sheriffs taking more shifts since officers were out due to contracting the COVID-19 virus? So
can you repeat that? I just want to make sure I get that exactly right. Overtime for backfill employees? Is that
yes, it would be overtime for backfill correction officers and deputy sheriffs due to their colleagues being out sick due to COVID.
Specifically for security and public safety. So generally what FEMA has said is for full-time employees, overtime is 100% eligible, you know, if they're working on the response activities. For backfill employees, regular time and overtime is covered, yes. I don't want to say 100%. I'm positive on that. I'm like 98% positive. So I just ask that individual reach out to me directly, and we'll follow up. We can have a follow-up phone call on that. So again, that email address is just dishespa-covid-19 at dhses.ny.gov. Please reach out to us, and we can work with you to make sure that you understand the eligibility.
Great, thanks, Andrew. And this is the last question, then we'll conclude the webinar. Would equipment expenses related to enabling staff to work from home be eligible for FEMA reimbursement?
Unfortunately, at this time, FEMA has that no, that is not an eligible activity or cost. Again, it's possible that that may change, but the costs of teleworking and telehealth and teleeducation currently are not eligible for reimbursement through public assistance.
Okay,
Again,
great. Thanks, Andrew. Yeah.
Sources out there that might be available through Department of Education, through Department of Health. There are a number of other potential opportunities, but at this time, not public assistance.
Excellent. Well, first, before we conclude, I do just want to thank our panelists again for joining us. Mary Gates in Ontario County, the Commissioner of Finance there. Thank you, Mary, for coming on and presenting the perspective from your county. And of course, our friends and colleagues at the Department of Homeland Security and Emergency Services, Deirdre and her team and Andrew have been incredible partners of NISAC, and we really appreciate this very timely information being shared to all of the counties across the state. And with that, I do also want to just thank our sponsor for today's webinar one more time, Civic Plus. And again, Civic Plus offers local governments technology solutions for a range of services. With more than 20 years of experience focused exclusively on local government, Civic Plus works with over 4,000 municipalities to help them achieve more with less. Reach out to Civic Plus with your technology needs, and they will ensure those needs are met. And Becky White from Civic Plus, her contact information is there if you're interested. And again, thank you, panelists, and thank you, counties, for tuning in to today's webinar. A copy of the webinar presentation slides as a PDF document along with a recording will be posted to the NISAC website at www.nisac.org/webinars. Thank you, and that concludes today's presentation.